You're watching the final part of our Chapter 2 series on mastering MHA MBA. We've covered the statistics and the drivers. Now we tackle the theory. Why does healthcare keep getting more expensive while other industries like tech get cheaper? Today we're discussing Baumol's cost disease and what it means for the future of healthcare management. If you're preparing for a career in health administration, this is the economic foundation you need. Section 7, Factors Driving Spending. The role of Prices. Anderson and colleagues famously titled their research, It's the Price is Stupid. There is a clear link between high spending and high input prices. US physicians earn considerably higher salaries than their counterparts elsewhere. Hospitals charge substantially more. Branded pharmaceutical prices exceed those in other developed countries. Lack of price transparency and price discrimination are prominent features of US healthcare markets. Pricing and competition markets do not work efficiently when consumers do not know prices. With little incentive to find out what they pay, often because they only pay a fraction of the total bill, consumers have no reason to be cost conscious. Lack of uniform pricing within markets, and even by the same provider, creates significant barriers to entry. This limits competition and removes any market mechanism to push prices down. Third party payment effect. A Wall Street Journal article illustrates how third party payment distorts decisions. A 70-year-old man had a $275,000 hospital bill, all covered by Medicare. His doctor recommended a $75 denture adjustment, not covered by Medicare. The man refused, saying $75 is a lot of money. When you spend someone else's money, 275,000 does not seem like much. When you spend your own, 75 is a lot. This is why third-party payment contributes to rising costs. Dieleman et al., 2017, findings. Dieleman and colleagues examined factors associated with spending growth from 1996 to 2013. Health spending increased over $933 billion during that period. Three factors accounted for 85% of the increase. Price and intensity of services delivered explained over half the change. Population size contributed 23%. Population aging added 12%. Prices and what we buy matter most. Section 8, Baumol's model. The cost disease. William Baumol addressed why healthcare costs rise relentlessly in a 1967 paper on unbalanced growth. He divided the economy into two sectors. The progressive sector has regular productivity growth through automation and innovation. The non-progressive sector, which includes healthcare, lags in productivity. Medical services are hard to standardize. Patients perceive quality as tied to time spent with them. This makes it difficult to reduce the labor content. How the cost disease works here is how Baumol's model works. When the progressive sector gets more productive, resources become more valuable there. Prices for labor and other inputs rise. The non-progressive sector must match those prices or lose its workforce to the progressive sector. But since productivity has not improved in healthcare, the only way to pay higher resource prices is to charge higher output prices. With inelastic demand, this means higher spending. Evidence of the cost disease. Since 1975, healthcare spending grew at 8.1% annually, while the rest of the economy grew at 5.8%. The gap averaged 2.3 percentage points every year. From 1975 to 1995, the gap was 3.4 percentage points. Since 1995, it has narrowed to 1.5 percentage points. After the ACA, the gap shrank further to about half a percentage point. Managed care and policy changes have made a difference. Can the gap close? There is strong correlation between healthcare spending growth and overall economic growth. The gap has narrowed considerably since the 1990s, when managed care took hold. The ACA contributed to further narrowing, but downturns in the overall economy tend to widen the gap and make it harder to address the relative spending problem. Whether these trends continue is anyone's guess. Section 9, Summary and Conclusion. Key takeaways. Let us summarize what we learned. US healthcare is a massive industry, over $4 trillion. It represents 18% of GDP and continues to rise. This makes it larger than the entire French economy. Spending growth has slowed significantly over several decades, but it still outpaces the overall economy. High spending is not fatal to our economic well being, but it deserves attention. Hospital care takes about one third of spending. Physician services account for 20% directly but influence most of the rest. Personal health care consumes 84% of total spending. Administrative costs approach 9%. Waste, including fraud, inefficiencies, and inappropriate care, may be as high as one quarter of all spending. Several factors drive spending growth. New technology and treatments improve outcomes but cost money. An aging population requires more care. Chronic disease prevalence, including obesity related conditions, adds to spending. Insurance expansion reduces out of pocket costs, which changes behavior. High input prices, especially for labor and drugs, matter greatly. And Baumol's cost disease explains why productivity gains in healthcare lag behind the rest of the economy. High spending is not automatically bad. One person's spending is another person's income. Innovation in healthcare requires investment, and that investment has paid off in longer, better lives. But wasteful spending should be eliminated. Every dollar spent on healthcare is a dollar we cannot spend elsewhere. It is past time for policymakers to put aside ideological differences and work together on reform that is more equitable, more efficient, and sustainable for future generations. That wraps up our analysis of healthcare spending issues. From global trends to the theory behind the cost disease, you now have the framework to understand why spending remains the most debated topic in our industry. If this helped you master these concepts, make sure to like, subscribe, and stay tuned for Chapter 3. This is Mastering MHA MBA, where we connect business theory and healthcare reality. See you in the next one.